You now understand that the distress and unhappiness you experience has little to do with the situation you're in. It's mainly due to intrusive feelings that have been triggered, feelings that are related to trauma from earlier in your life. Unfortunately, intrusive feelings always involve us feeling bad. We never get to experience intrusive joy. The bad feeling can be that something bad is going to happen, that something bad has happened, or that we are bad. The first, that something bad is going to happen, is the feeling of fear. Fear comes in many flavors such as anxiety, nervousness, worry, apprehension, panic, dread, and terror. The second intrusive feeling, that something bad has happened, is pain. And we say that we feel hurt, loss, sadness, longing, heartbroken, devastated, despair, or grief. The third intrusive feeling, that we are somehow bad, is shame. And this includes feeling embarrassed, humiliated, guilty, inadequate, useless, repulsive, dirty, or flawed. So, when we're feeling bad, the intrusive feeling always includes some quality of fear, pain, or shame. I call these the stop feelings, and later I'll explain how they're linked to trauma. Because intrusive feelings have their origins in early trauma, we feel like we're under some kind of threat. So the fight or flight reaction may also be triggered. We may feel angry and inclined to fight, or we may feel agitated and an urge to run. If you experience these intrusive feelings, you may be prone to anger control problems or hyperactivity. Finally, when we're traumatized, particularly when we're very young, the fight and flight reactions quickly give way to the freezing reaction. The freezing reaction is something that exists in all mammals. If our efforts to deal with a threat through fighting or fleeing prove futile, it's not working, like when a predator is about to have us for lunch, we collapse into this freezing reaction. Essentially, we're immobilized. You don't need to know anything more about this at this point, but freezing is another reaction that's triggered by situations that somehow remind us of past trauma. Freezing is common in depression. It's also often present when people have difficulty thinking or speaking when they become anxious. So, these are the main feelings that can be triggered by situations that remind us of past trauma: fear, pain, shame, and the impulse to fight, flee, or freeze. Just like with trauma in adulthood, however, any aspect of the traumatic situation may intrude and color our experience, not just feelings. In a full flashback, we relive the whole ordeal. For a war veteran, the sound of firecrackers may transport him back to the battlefield, including the smells, the visual images. Similarly, with childhood trauma, along with the intrusive feelings, we may be haunted by a sense of the world being hostile to us, or maybe indifferent to us, or that we're the victim of unfair treatment. You can now see that the intrusive feelings that get triggered in us involve some quality of feeling bad. Because these feelings color our current experience, they inevitably leave us feeling distressed and less happy in our lives.